Welcome to the 101 Ways podcast. This is us giving back to the tech community by sharing ideas that matter. And with 101 ways to solve any problem, we hope you'll find ideas and expertise here to solve yours. Don't forget to follow us on Spotify or YouTube or wherever you listen or watch so that you know when the next episode arrives. We've got plenty coming up. So today, I'm Ollie Happy. Actually, I'm always Ollie Happy. I'm your host, and I'm product principal at 101 Ways. This week, I'm joined by Charlotte Bemand, Director of Digital Product and Business Partnering at HBK. Welcome, Charlotte.
Thank you. Nice to be here, Ollie.
It's a pleasure to have you here. And the topic today is a really interesting one. Today, we're going to be talking about the Covid-19 vaccine rollout and lessons learned. What an interesting and fascinating piece of work to have been involved in. And thank you for coming along to share. So let's start with you. Let's start with a little bit about your background and how you came to find yourself working on a program of such importance.
Yeah. So my background's a bit odd. I'm a bit of a mixed bag. So I started out in health psychology and then moved into public health. So lots of strategy and needs assessment and commissioning of healthcare services. And then I went and ran healthcare services. So I was an operations director in an NHS trust for a number of years and really specialised in delivering great outcomes and focusing on patient outcomes, but also improving practice and satisfaction for teams delivering those services as well. And I had worked in the NHS and healthcare for 10 years or so. And then I thought, I wonder if I'm transferable and wonder if I could do more. So I went out and worked in the retail sector and did some really great roles around transformation, big program deployments, developing strategy and long-term frameworks. And then suddenly the pandemic hit. So I'd been out of healthcare for nearly 6 years at that point. I'd had a, very mixed career, not a traditional path, but the constant in my route had always been delivering change, developing strategy, and translating that into really tangible actions and helping businesses transform.
Interesting. So before we get on to the topic at hand, something that really interests me is how you would relate the work that was done in delivering services in the health sector to retail, because I see a lot of parallels, but I think folks that haven't worked in both sectors might be surprised to hear that there's still similarities.
Yeah, absolutely. And I always say, B&Q and Specsavers, in one sense, both took a risk on me because I was a bit of an unknown quantity. But in another way, there was a brilliant skills exchange because I learned a lot about retail from both of those businesses and working with leadership teams there. But I also brought change and transformation skills into those businesses and supported them on their journey. And I think, at its core, probably there's 3 things that were just constant, whatever organization I was in. And it was, being able to understand your why. Why are you there? What are you trying to achieve? What's the problem we're trying to solve or the outcome we're trying to improve? And being curious around that problem, so going broad and deep in your network and linking with all the different experts in a business and getting all those perspectives so that you could really support leaders in what's the solution here or what are the options that we have on the table. I think the second thing that was a constant is bringing people together. So, how do you effectively collaborate? That's about building relationships, building a network, being able to have conversations one-on-one, in small groups, informal group settings, and being able to kind of easily navigate between those so that when you need to bring the right people together into a conversation, you just bring the right people together. It's second nature. And again, I think in the 2 businesses outside of healthcare I was working in, just that bringing the right groups of cross-functional leaders together on big cross-functional programs was something that helped in making those step changes that the business was looking for. And I think the final area for me was, bizarrely, public health and healthcare services are very data-driven. People might not realize that if they don't work in healthcare. And so that commerciality, that focus on how you're performing, again, was an easy translation for me, so that when we needed to be data focused in our decision making in those organizations, there was a comfort there, and I could interpret and analyze different information from different corporate teams across the business to help us create that focus and kind of create that strategy. So I think, they were certainly three of the things that were transferable in me, and I realized as I went on that journey could add value.
Interesting. And we're really seeing now, aren't we, with the rise of Gen AI, an understanding or perhaps a realization that is built on a foundation of good data, which has just created a wave, hasn't it, of businesses having another look at their data and realizing that they aren't yet data-driven and need to be. And it's fascinating, the complexity, as we'll come to, in healthcare and delivery of healthcare services. And we all give a lot of credit to the people on the front line who are helping folks that are in need. But I think few understand the complexity behind the scenes, which is really interesting. All right.
Those frontline colleagues are data-driven themselves.
Yes.
A lot of people, again, sort of think, that those colleagues are following protocols and aren't making clinical decisions in their care, but they are every moment of every day, and they're looking at data and they're understanding you and your outcomes. So it's quite an intrinsic mindset and skill set within healthcare services.
And that does make sense because it's the science of delivering healthcare, isn't it? That does make sense. All right. So tell us set the scene, if you will, for the program that you are involved in and the pandemic and the vaccine rollout.
So when I joined the program, it was the start of November 2020. And at that point, there had been a cross-government department vaccine program running for approximately 6 months. So that program had been sourcing basically deals with major manufacturers in the hope that one of those vaccines would be effective, and was planning on an assumption that one of them will be effective and it'll also be safe, and therefore we'll be able to go through regulatory approval, and had begun bringing all of the different government departments together to think, well, how would we mobilize this? And the task in hand of, once we have a vaccine, it's approved, how are we going to deploy it, fell to NHS England. So when I joined the program, Emily Lawson headed that program, approximately a team of 400 people coming together to mobilize that deployment across England. And everybody in their workstream areas, they were leaders in their field. Yeah, they were either, experts internationally or experts nationally in their given area. But they were all planning on a set of assumptions where nobody knew for sure that we were going to find an effective vaccine, and then that we were going to be able to produce it and manufacture it in time and get it through regulatory approval. So the pressure in that scenario is about wanting to save lives, wanting to do the right thing, but knowing that the planning context you're working in is unlike anything I've ever seen. People say we live in a kind of uncertain, ambiguous world, and, big programs have that level of uncertainty. This was nothing like that. We were sometimes in conversations 3-4 times across the day, with planning information changing that frequently and updating. And so, yeah, the pressure was on this team that, if we find a vaccine and it's effective and the manufacturers can produce enough of it, the pressure's on us to get that vaccine out and deployed and into people's arms and give them the protection for them and their loved ones.
It's quite a fascinating mix of urgency and uncertainty, isn't it? Because it's rare to have that degree of urgency when the product is not yet sourced.
Yeah. And you're also dealing with different characteristics on those vaccines. So depending on which vaccine came through first, it actually affected our cold chain requirements and logistics requirements for all of our services. So you're suddenly in this, okay, well, we have not plan A, plan B, plan C, but we have multiple plan A's, multiple plan B's, that kind of agility in your scenario modeling, was intense, but also needed you to bring everybody together. And that was the role that I played, really. I supported clinical leaders in NHS England to bring workstream leaders together and to make sure that our planning conversations and the assumptions we were working with were connected and that we were managing those interdependencies and risks as much as we could. Right.
And just to ensure that we cover that, although we all know the end of this story, that a successful delivery was made, thank you. What were the steps at a high level to throughout the program?
Oh, crikey. Many. I think if you're going really high level, we were planning based on the public health evidence of those who needed greatest level of protection. And so that meant that we were planning around clinical vulnerability and particular groups in the population that we needed to identify and we needed to be able to reach. We were also planning universal rollout that was age-based and was working through ages in priority order. And then we were also thinking about specialist settings that would need a different model to reach people. So how would we deploy into care homes? How would we deploy into settings for people who were receiving care for different reasons? How would we deploy into the prison healthcare system? So you can already see that in parallel, that scenario of which vaccine, which logistics supply chain and an operational model was then also having to be augmented into those 3 different scenarios. And it meant that our program effectively went through phase 1 and phase 2. And phase 1 was reaching our highest priority clinical vulnerability groups and working through our older population down to around age 50. And then as we got through into the spring, actually, phase 2 was about reaching the whole population under the age of 50 and thinking about young adults in that as well and trying to encourage uptake around those kind of under 25s in our population.
Yes. And the end-to-end program was relatively short, wasn't it? Numbering weeks rather than months or years.
Yeah, so as I say, there had been this kind of 6 months of a program established and running, but when I joined at the start of November, we didn't have a service model defined. We didn't know, which vaccine was going to be deployed and therefore how we'd need to deliver it to places, and then how our clinicians would need to be trained to support people giving the vaccine, and also how we'd need to communicate with the public about that vaccine. So lots of unknowns. And that was a 6-week period from when I joined. We received confirmation through that period, and we deployed the first vaccine on the 27th of December.
I mean, that's incredible. I don't think you could build many web services alone in 6 weeks, let alone all of the different elements of the program.
Yeah. We built 1,000 services in that period. So that was the number of sites that we deployed through, and they were new commissioned, contracted services where we were having to provide new clinical guidelines, training, quality assurance, and that supply chain behind.
And sourcing all the people, the volunteers and the staff. It's amazing, really. And what did it, before we get into some of the lessons learned, what did it feel like to be involved in a project that was so important, but also so well staffed with people?
So I'm a very values driven individual. Anything I've done in my career, I've kind of worked in that area because I can see I can make a difference, either to patients or to customers or to colleagues internally. And so, it was, very purpose driven, and that created a real sense of camaraderie because in the NHS in particular, a lot of people, choose that career for that reason. They aren't there necessarily because of really high salaries, they're there because they make a difference in people's lives. And so I think for the overarching culture, that was a given. But you definitely had a group of people sensing that urgency and sensing that, a whole country really was dependent on us being able to deploy this successfully and to protect people and save lives and get back to, a form of living that we all recognised. So that definitely created pressure. But there was a culture from the top that was about being open and transparent around risk, impact, information that you needed, and it was encouraged at every level. And there were quite flat sort of structures in terms of how people came together. And so it meant that people called out the things they were worried about. And actually, when you're working under that pressure, you need to do that. You need to feel safe enough to say, there's a risk here and I'm worried about it, and these are the options I see and what can we do. And so for me, that purpose, it was one of the most rewarding programs I've ever worked on in my career, for sure. But I recognized that it was also happening at a time that was terrible for many, many people. And so, that focus meant I probably didn't have time to be experiencing lockdowns and isolation and, impacts that other people experienced, because we were 7 days a week working focused on, delivering this solution.
Yes. Did you, that it sounds like that kind of environment could be a bit of a pressure cooker for some of the people involved. Did you experience the sort of signs of the need for wellness and for carefully managing workloads to try and avoid burnout? Was that a factor? Or did you find that this is a group of people who were just going to get the job done and then rest?
So this was definitely a group of people who were going to get the job done and then rest. But also, very quickly when we realised that we were needing 7-day working, rotational cover and on-call cover across those 7 days kicked in so that the load was being spread. And also, again, being part of a healthcare service, perhaps just intuitive to some of those leaders to check in on your well-being and see how you're doing. And one of the chief execs that I worked with closely said, we've just been working through a war zone scenario, Charlotte. And when we came off the program, she made me take a month off to decompress. And at the time I thought, I don't need a month off. I've been running, it's all fine. I'll just have a week. And then when I got to it, I thought, she made the right call. I absolutely needed that time to just decompress. because we were working at a pace that, was unprecedented.
Yes. Yes. And that, of course, is intuitive in leaders in healthcare, because A&E is always open, right? And wards are always functioning. And it's fascinating to think about what the business world can learn from the healthcare world in that sense. So let's dig into that a little bit more. What did this process, and it's fascinating that you stepped out of healthcare into traditional business, if I could call it that, particularly retail, and then stepped back in. What did this process teach you? What were some of the big things that you learned?
Yeah. So I think we've already touched on it a little bit, but, having that clarity on your why is the way that you galvanize the team. And so every single person in our program knew what we were there to achieve, knew the ultimate end goal that we were all working towards. And I think it would be easy to skip over that, because you'd say, well, yeah, and you all brought together on a vaccine program. But actually, there was really good communication with a very regular cadence and a transparency coming right from the top. And so those conversations, even with the Prime Minister and our politicians, absolutely being cascaded back to the whole team. So everybody knew, what are we doing? What's the feedback we're getting? How close are we to our goal? But I think probably more importantly for me, it was the most agile program I'd ever worked on. And it was agile because it was principle-based in the way that teams worked. So we could have, gone down a route that became very governance heavy if we weren't careful, and could have, by trying to collaborate and bringing people together, slowed process. And actually it didn't, because we worked around principles. And for me, they'll sound simple, but they were very, very effective. It was about ensuring that every decision we made, or every piece of planning information we were working with, we understood the impact. So we were deliberately looking at that in a 3-dimensional way. So the group of stakeholders I brought together and was working with regularly, I would proactively seek opinion across those work streams, across those leaders. You didn't assume anything. You double checked the understanding and the impact. And it meant that we really were comfortable articulating risk and identifying risk, and then rapidly working through what are our options to de-risk this or to mitigate it entirely. And that management of risk in a very practical, hands-on, not risk-averse way was definitely part of the success, I think, because it would have been easy for people to catastrophize and to say, but we don't know this. So, how can we possibly? And you had to say, right, okay, we don't know that. So let's work on this planning assumption. And when might we get that piece of information? And when might we be able to connect with these colleagues? And you had to have a 3-dimensional kind of dynamic level of planning that really brought agility. And I think, the catchphrase that came from Emily at the top of the program, but actually was used consistently, by teams and even myself as well, was, if we were talking about a decision, understanding what needed to be true to make that happen. And that extended all the way through into how we modeled scenarios as well. So yeah, that working with agility was about being able to unblock, being able to work with planning assumptions at pace, but doing that through a principles-based approach. Everybody recognized, I have to understand the impact here. I have to articulate the risk as I perceive it from my work stream or my area of expertise, but I'm also part of the solution. I'm part of articulating, but how could this, be supported, or what might we be able to do to de-risk that? So I think principle-based working, I've always been a fan of, but it was seeing it really in action And it's
Yeah.
something I've then taken with me since.
Thank you. Yes, and I think we'll probably unpack each of those in turn now, because there's a lot of good learnings in there. Fascinating to hear you describe what is effectively a textbook correct example of a product-led delivery, in the sense of know your why, get everybody aligned, and so forth. These are things that people talk about a lot, and I think most senior folks would be able to repeat a lot of these principles. But as you say, it's in the application that we really begin to understand them. So perhaps just start with the principles, and starting with why. I have a feeling that a lot of leadership teams don't get beyond understanding in themselves, let alone as a group of exec or board, what we are really trying to achieve here. But I feel like there's steps beyond that. I feel like you were extending that to everybody on the program from the moment that they touched in and along the way.
Yeah.
Is that right?
Yeah, absolutely. So there were those kind of global town hall style meetings for everyone on the program. But they ran with pace and focus, and as I say, there was a real transparency around information that was coming through from all those different work streams, all those different government departments, and from government itself. And in parallel, we had the right forums to bring together those cross-functional work streams that had those dependencies. So that was part of what I supported in terms of our approach to planning and mobilizing that deployment. And I guess, at its core, as well as using those forums where you might be connecting once a day, twice a day, sometimes even 3 times a day, you were also communicating a lot one-on-one, and you were also communicating informally with people. So you'd work out someone's preference in terms of communication style quite quickly, and you'd work out how you could reach them and how you'd get a response. So I did as much on my phone over WhatsApp and over text and calls with people as I did through face-to-face meetings. Because,
Fascinating.
level of agility and movement in what was happening day on day, it meant you sometimes couldn't wait till, we've got that meeting, but it's at 5 o'clock tonight. You'd go, no, this person needs to know this information now. And you'd proactively reach out. So I guess the communication piece for me was truly about adapting to other people's preferences quickly so that you could communicate effectively. And knowing that it was equally as important to do that one-on-one and informally as much as using those kind of structured sessions and forums that we're in.
That's fascinating. And of course, if we take this right back to the idea of reaching any audience, of course, there are a number of channels to do that, and finding the right mix of channels for the audience and the situation is just part of building a good communication strategy. But many of us don't do that, I think. Many of us have a default that we have a rhythm. And, as soon as you said 2, 3, 4 times a day, I thought, how did you fit in so many meetings? And of course, they weren't always meetings, were they?
Well, and even the ones that were, they were focused, yeah. There'd be a 15-minute or a 30-minute stand-up, and so it meant that you needed to come in and say, this is my progress, this is what I'm worried about, this is where the risk is, and my role ended up being, coordinating those conversations between people. But I also think there's something in what you said there around, how do we reach people? And, that was the other part of the program for me, that again, my reflection is, it was so data driven. And again, a lot of businesses use that phrase, but it was data driven in a way that we were really taking those planning assumptions and the insight we had and building it into modeling scenarios to understand our operational capacity and how quickly we could deploy it to different settings and reach different communities. But we also, as a program, were very focused on monitoring uptake. So we were starting to understand, those communities where we had slower uptake, those communities where we didn't have enough services, those communities where there was vaccine hesitancy. And it meant that we also did some work around behavioural kind of modelling, if you like. And we thought about, well, how are we going to invite some of these communities in to receive services? And we changed. We worked with, psychologists, and we changed the language for different groups to support them to take up that invitation when they received it. And we also thought about, okay, well, there's a traditional model of services here, but, what if I don't want to book an appointment? What if I don't even have a smartphone to be able to receive my text message and go online and book an appointment? So those conversations around how do we create walk-in services, how do we create outreach services for different communities, came off the back of being data-driven, about understanding that there were a whole range of people that our traditional appointment-based model wasn't going to work for. And, again, healthcare services are data rich. And when they use that data can create incredible outcomes for people. But we were having to create new data sources to model, to see uptake, to understand behavioural patterns in terms of uptake. And that actually, for me, was probably another key reflection of just that adaptation wasn't just in communication, it was in the whole service offering, actually, because this was a universal expectation. Everyone who wanted to be vaccinated should be able to be vaccinated. And so, how we use data to support some of those decisions, but then also to monitor our progress and adapt as we went on that journey. Again, probably the best I've ever seen that in practice, healthcare or business.
That's really interesting. Just as a brief aside for folks that are beginning their data-driven journey, what sort of groups of people were involved in that research and discovery and analysis piece?
Huge number of people. So we had behavioural psychology experts on a national panel providing guidance. We had modelling experts, statisticians, data scientists and analysts working across public and private sector organisations in one augmented data team. We involved communications colleagues and communications colleagues across the Cabinet Office and NHS England. But we also worked with third parties who understood market research and understood behavioural elements of market research within that. So it was a truly diverse group of people. If you just take understanding uptake, modelling, and how we adapted some of the behavioural invitations, they're a really diverse group of people, not just traditional data colleagues. And all of those touch points also then flowed back through clinical leaders and operational leaders that were accountable for those services. So you had a great partnership between people who knew the numbers, people who could support interpreting the insight, and then people who actually then needed to make the decisions and use that information in their service delivery, with some other help and expertise wrapped around it as well.
Yes. Okay, thank you. And it just really feels like an example of what is possible if a program is perfectly funded, if you know what I mean.
So I think funding, yes, it was a priority nationally, but I actually think there's a more fundamental reason why it was so successful, and that is the NHS strengths that were already there were harnessed, and the NHS was just allowed to do what it does best. So it has huge public health expertise in data. We often don't realise that we are world leading in a number of fields, and creating that level of insight and connection to decision making is something that in other clinical areas of work and clinical programs the NHS does, but is quite hidden from the public. Whereas we all got to know about Jonathan Van Tam and the JCVI by the end of the pandemic through those kind of regular updates. I think the second thing is that the NHS, clinically and operationally, when it is left to its own devices and doesn't have political intervention day to day, can deliver fantastic outcomes and mobilise great services quickly. And it kind of proved that it could do that. And I think the other thing that, my time working in the NHS pre-pandemic and then through the pandemic showed me, is there's just an incredible group of people who are really passionate about what they do, and there's some fantastic leaders. And again, when they're left to focus on the outcome and deliver it in the way that we know how, a great outcome, world-leading outcome. So I think for me, it wasn't just funding, because it would have been very easy to throw money at the vaccine deployment and for that to have been wasted. And it wasn't every single vaccine through that data-driven approach was accounted for. We knew that every single vaccine, had to make a difference. And so I think for me, money was a part of it, but it was much more about enabling the strengths of a system to be harnessed quickly and to be allowed to work in a way where they could have best impact.
Which really, having spent most of my life working with people delivering important things, is pure program delivery ethos, isn't it?
Yeah.
Harnessing what's there and bringing the outcomes in the most orderly and efficient fashion.
Mm-hmm.
I'd like to just touch on risk, because you mentioned that as your second interesting reflection. I think most listening, when they hear risk, will think delay. And yet, in this case, I get the impression that you were really embracing the risk that was intrinsic in the process, both in terms of the risk of sourcing a supplier, the risk of the use of the vaccine being very new, and also the risk of delay. Do you want to just talk a little bit about how you and the program managed the risks so that they weren't as much of a hindrance as they could have been if they had not been managed?
The conversations I were having were all about problem solving. And my approach to problem solving has always been about how can we deliver change in a way that people can buy into and can support. And you have to break down a problem into its constituent parts, and you have to understand the options that are in place for each of those parts. And so risk management on this program wasn't about I'm raising a risk and this stops everything, even though sometimes people were saying, I'm worried this could stop everything. But it was actually then about saying, okay, so what are our options here? What do we need to understand? Who do we need to connect with? Who could we draw into this? And sometimes that might be about expertise and knowledge. Sometimes that might be about resources. But sometimes it might actually be about how do we break down this step and just take it slower to go faster. So, often those risks were about the interdependencies. They would be connected to other key planning assumptions from other work streams that we didn't know yet. And so you had to, assess those, understand your options, but also continue to move forward. And so, as well as things changing multiple times across the day, you know, we were in 24-hour planning cycles. And that's why I say it's the most
24-hour planning cycle.
Yeah. Most agile program I've ever worked in, because you would come off one call and just be saying, what's happened in the last 24? What's happened in the next 24? And you'd have an eye out on end of the week or the following week, but we weren't really beyond a couple of weeks in our planning assumptions. We were working in 24-hour cycles. And so that means you just problem solve. You have to, because otherwise your progress in that 24-hour period is going to stall. And yeah, we just weren't in a scenario where we could accept that, where we were prepared to tolerate that impact as a result of a risk. So yeah, problem solving for me, something I've always been comfortable with. But everyone on that program, because of that culture of understand the impact, understand the risk, understand what we can do, then you just got into really deep problem solving conversations quickly with each other. And there'd be certain directors I would just have on speed dial, you know, that I would routinely be reaching out to every couple of days to say, right, we've done this. We now need this input from you, or what, you know, we're planning with this assumption. Are you still aligned on that? Or actually, we need this from your team now. It's getting critical. And it's, again, probably also not being afraid to have those conversations and be honest and own, you know, take some ownership and accountability for the whole team can only get so far. We're needing this from you.
You know, it sounds a lot like the environment of an early stage startup or an incubator project within a larger organization, you know, where there's a real shared ownership, because there might be 8 or 16 or 30 people involved only. But to have that at such scale is quite fascinating. Something else I'd like us to dig into is, you made a comment that's fascinating, which is what needs to be true for this to occur, I think it was. Tell us a bit about that.
Yeah, so it was definitely the mantra of Emily Lawson, who headed the program. But so, for example, when we were looking at modeling of uptake so that we could understand the vaccine supply volume and pattern, if you like, that was going to be coming into the program, along with our operational capacity, what you're wanting to do is optimize the equation between those two things, yeah? And so being data-driven kind of gets you to a point of understanding we're going to have too much supply or too little, or we're going to have, you know, too many appointments and not enough vaccines, or the inverse. And so what needed to be true really became, again, a focus on problem solving to some extent, because you'd be starting to identify, you know, what can we be negotiating upstream in terms of kind of volumes on delivery? Are there any choices we're making in logistics that will speed supply to different parts of the country? When we're looking at operational capacity of services, you know, what are our options around scaling? Well, sometimes that might have been open more services. Sometimes it might have been extend opening hours of services. Sometimes it might have been we need more volunteers or more staff. So what needs to be true kind of became a very focused way of being able to summarize, you know, for this planning assumption we have at the moment, and for us to take this action with this outcome, we're assuming all of these things will be in place. Or sometimes beyond that, you know, we need to action these things now changing and happening. And so a lot of people used that phrase in conversation, one-on-one or in groups, because it's an open question. Yeah, it means you can take any idea and any thought from anyone who's in the room, the virtual room or the physical room. And remember, this was all being done predominantly virtually as well. So it gives permission, because it's not a loaded question. it's okay, we're striving for this outcome. We're understanding what might be blocking us, but how do we turn those blockers, those risks, into the things that help this to be delivered?
And have we, as a group of people, missed anything? A real many eyes on the problem type situation.
Absolutely.
Interesting. So now I'd just like to take it back to us in the real world, if I can call it that, post-pandemic, and what you've learned that you would turn into advice in terms of people who are in roles where they are trying to get done with a group of people something that's important to their organization. And I think you've, just before we jump into that, something I just observed is that it wasn't agile perhaps in the sense of agile ways of working only. There was also a real sense of agile decision-making happening. And that's really key, isn't it? Because it's one thing to get the group of people together and get aligned, but you were making decisions very rapidly. Yeah.
Absolutely. And feeling empowered to do that. Yeah. So making judgment calls, and knowing that, if you needed air cover or connection, you could go and get that, but also knowing that as a team, we were being empowered to make that happen, to get the job done. And so I think there's lots of different things I learned, but I mean, the first thing for me is if you have data to support decisions on a journey that you're going on through change, use it. Even if it's minimal data at the start of your journey and you're building that as you go and your maturity builds, whatever data you have, it will always add another dimension and another perspective to voices in the room and the expertise that's assembled. So it's an obvious one, but sometimes I think because we don't have data in certain organizations, we aren't naturally leaning to, is there any data that could help us? And I think there often is, and it's sort of, that's how you build that path to maturity.
That's a big one, because a lot of teams get stuck waiting for, looking for, seeking funding for, collecting data so that they can make something true. Yeah. There's a real just-in-time, agile, let's just use what we have today and build on it incrementally mindset behind it.
Absolutely. And, like my team at the moment, we have an OKR framework. We're now starting to report against that. I'm about 4 months into my job. And, some of that means it's manual. And some of that means, we don't have an automated measure for that yet. But how could we start to understand it? And it's really important to start building that pathway you can. I think sort of another piece for me is, it's kind of been central to my values anyway, but it's not being afraid to act with integrity and do the right thing. So again, in pressured programs and scenarios and highly political programs, people can often shy away from calling out a risk or identifying a problem. And actually doing the right thing means you call that out, you raise it, but you also put forward, solutions and options of how things might be able to move forward. And there were a couple of times for me on the program where I absolutely escalated things that at that point haven't been seen anywhere else in the program yet. And if we hadn't done that, we wouldn't probably have had success that we had in certain areas of deployment. So you have to have a confidence as a leader to say, no, I'm going to act with integrity on the information my team are giving me, and I'm going to make the call that says we have to do the right thing here. And I don't sometimes see people do that. But I think that transparency is the way that people buy in to the change you're trying to deliver. So that's another one for me. And I think, we brought people together under immense pressure, and it probably means that my threshold for pressure and what is truly life-threatening and life-changing is pretty high. So since the pandemic, when I've been in businesses, there are things that are kind of water off a duck's back. I just go, yeah, okay, we'll work with that. But we don't need to put people under pressure to work 24/7, 7 days a week, or to meet deadlines where your team are struggling, And so I think there's this pragmatism to, is it truly urgent? Is it truly important? And getting underneath that so that you prioritize in a way that just lifts some of that pressure. Because a lot of organizations and businesses at the moment, they're trying to deliver a lot. So it's creating that sense of space and permission to say, let's prioritize, let's ease the pressure, let's create that focus that we can still keep pace, we can still keep agility, we can deliver great things, but not necessarily to, the point where we need to break people.
And some things can always wait, because priority by definition is a ranking system, and not everything will be at the top of that list.
Yes, absolutely. And I think, the other principles we've talked about really, but they all are relevant in my day-to-day. I'm still using them in how I work.
Awesome. Thank you. There's so much in there, and I'm sure that folks that are listening will be glad they've invested the time. So any closing thoughts before we wrap up? Anything you'd really like people to take away?
I think just knowing that if you're part of delivering a big change somewhere, that can often feel that you are alone in that change, because you might be the person that's there as a change agent, and you might be the person that is there to model the way through for others to follow. And so within that program, but also all throughout my career, I've ensured that I've got a really strong network of people that I can turn to when I'm going, right, okay, am I making the right decisions here? How am I feeling about what I'm working on? Oh, I need another perspective. And power of the network, I guess, would be my reflection, that even on that program, there were a couple of places I turned to outside of that program team that just gave me support, gave me perspective. And everyone's needing that in their life, I think, because delivering big change can set big expectation, and you don't want to be under that pressure. You want to feel supported and empowered and know that people have got your back and you can do the right thing. So that's really good. Trust your network.
Really good advice. Something that I've also found, and it surprised me as a leader, is that folks in my team would often see me as a person and offer some support that I didn't expect and really valued and probably really needed at different times. Did you find that also, that people within the program from places you might not expect were willing to be really supportive and give good advice when it was needed, if it was listened to?
Yeah, and I would say, I guess, I didn't view it as from places I didn't expect, because there wasn't a hierarchy in the program per se. So there was obviously a structure to the program and a leadership team. But actually, it was an incredibly flat structure and hierarchy, and it was a very empowering kind of culture where everyone was encouraged to contribute and participate. And so I guess it was more people were kind and generous with their knowledge and their expertise. So that's the bit that I think I saw at every level across different work streams and lots of different specialist areas, if you like, that even under that pressure, people knew that help you understand the impact or the decisions you were needing to make, that they needed to give you that bit of time. Sometimes that might only be 5 or 10 minutes answering what would appear a very stupid question. But people were very generous with that time and expertise and knowledge, and knew that if they invested in that, it would also help them to deliver their goals. And yeah, people checked in with each other. Because maybe you just did when you came on at the start of the day or when you were logging off, people would check in, So
and you needed to.
What are you doing tonight? Are you going to switch that phone off?
Yeah, we're in this together. Yes. So maybe one last thought. How would you recommend? And I know that as you join organizations, change and culture is a big part of your role, right? So how would you suggest that folks who join an organization in a position of leadership and can see that there's a cultural aspect to what they're trying to affect, how would you suggest that they build the kind of culture that has that kind of level of empowerment and honesty and integrity?
So I guess there's two things. So I think, whenever you join a new organization, you're building your network quickly, and you're establishing rapport, and you're working out your stakeholders that are on board in that journey and those that you need to be working with and doing some convincing with. And that comes from understanding where they are. So you have to really put time into listening. You have to, actively listen to their experience, the barriers and challenges they deal with, the perceptions they might have about the change journey you're trying to go on. And that isn't a one-off. So you do it when you start, but it's constant. Every conversation you have has to have a part of your antenna and your radar kind of tuned into, like, where's this person at? How are they feeling? And like, have they changed perspective on that? So I think that's really important for me, just day to day. I think the other side though is that, if you're leading a team, it is that opportunity to bring people together, whether you're virtual or you're face to face, and to have the conversations in the way you would want to, be spoken to. And for me, that's always been honesty and openness, and nothing's off the table. And you have to invest that time to start to build trust. And so for me, what I would hope is that teams that work with me know that, nothing's off the table. And that creates a safe space to share fears and hopes and the reality of what you're working on. And through that, people start to become more empowered and take forward the things they're passionate about and the opportunities they see and what they believe in. And 9 times out of 10, the people I'm working with on my teams, they're far more talented than me. They just need to be given support.
Yeah, watering the garden, right?
Absolutely.
Thank you. I'm just really grateful to you taking the time to share what you learned on a really unique scenario that hopefully none of us ever see again. So thank you for taking the time. And thank you folks for listening in. Hope you've enjoyed it as much as I have. And we'll see you next time for another interesting episode on 101 Ways podcast. Look after each other, and thank you, Charlotte.